Mr. Higgins, no. Ms. Sewell? Ms. Sewell, no. Ms. Del Bene? Ms. Del Bene, no.
Mr. Upton?
Votes aye.
Mr. Upton votes aye. Mr. Shimkus?
Aye.
Mr. Shimkus votes aye. Mr. Murphy?
Aye.
Mr. Murphy votes aye.
This committee stands adjourned.
All right, folks, 2 House committees approved the GOP health care bill after a combined 45 hours of debate that continued through Thursday night. But that was just one of many hurdles the bill faces, including opposition from conservative Republicans in the House and Senate. But that didn't stop President Donald Trump from spinning on Twitter. He tweeted, "Despite what you hear in the press, health care is coming along great. We're talking to many groups and it will end up in a beautiful picture." Did he forget all of the people who said they are against it? House Speaker Paul Ryan, the architect of the Republican plan, used a PowerPoint presentation to explain the bill to reporters.
This is the closest we will ever get to repealing and replacing Obamacare. This is something that we as conservatives have been dreaming about for decades. This is the chance and the best and only chance we're going to get. And that's why I'm really excited.
Oh, but not all Republicans are happy. Some in the House and Senate are saying not so fast among their objections, opposed to the bill moving at such a fast pace without a known price tag.
This needs to be changed in a dramatic way for it to have a chance to pass, in my judgment.
I think the president was very clear when he said this bill is open for negotiation. That's exactly right. And the bill as written is not going to pass the Senate.
Oh, here's what Arkansas Senator Tom Cotton tweeted. Boy, politics by tweet today. House health care bill can't pass Senate without major changes. To my friends in the House, pause, start over, get it right, don't get it fast. Joining us to talk about this is Republican Congressman from Texas, Bill Flores, who sits on the House Energy and Commerce Committee, one of the 2 committees that approved the bill. All right, Congressman, so you have people who support it, but then all of a sudden, I mean, you got the Koch brothers and their organization, AARP, the American Medical Association, and others who say this thing is dead on arrival. Well, what's going on here? You don't have a unanimous consent, if you will, on your own side.
We don't have unanimous consent at this point, but let's take a step back. We talk to the people that matter about this. We talk to the families who really don't have health care coverage because they've got a $10,000 deductible. We talk to hospitals. We talk to doctors. We talk to insurance companies. And one of the most important stakeholders we talk to are the governors that are having to deal with a broken Medicaid system. We talked to them, and we tried to find a plan that would deal with their 3 interests. And we've got a 3-step approach to deal with this. And at the end of the day, the folks, I mean, you heard Senator Cotton talk about he's going to have to go home and tell his voters in Arkansas why he voted no against our plan and essentially keep a broken Obamacare system in place. But that's what he's got to try to do.
There are Republican governors like John Kasich and others who are saying that they support the expansion of Medicaid and that this bill will hurt their constituents. And then also they say it will hurt the people who voted for Trump in West Virginia, in Kentucky, in Ohio.
Well, I disagree with that because if you actually look at what we did, we took care of the issues that expansion states have to deal with. We also took a look at the issues that non-expansion states have to deal with, and we tried to thread that needle pretty carefully. Look, this plan has input from expansion state governors and non-expansion state governors, and it really is we found an equitable way to deal with both. But Medicaid, as we know, it's broken. By not changing the expansion system, you're crowding out the people that Medicaid was designed to take care of. The folks that are poor, folks that are disabled, the elderly. So why would we want to have able-bodied people crowding out the ability of the original vulnerable population that Medicaid was designed to take care of?
Now, yesterday, Sean Spicer, he said, or day before yesterday, he said that there will be input from a variety of people.
Correct.
Amendments will be able to be placed. In one of the committees, when that came up, Chairman Pete Sessions said, not in my committee. And so Democrats are saying, wait a minute, how can Republicans on one hand say from the White House, amendments will be allowed in the committee, but then it wasn't allowed.
Well, in the Energy and Commerce Committee and the Ways and Means Committee hearings that we had over the last 48 hours, amendments were brought up on both sides of the aisle for both of those. So we did have an amendment process. There may also be a limited amendment process when it comes to the floor of the House. We'll have to see. I mean, one of the steps that we need to see is what is this bill going to cost and what is it going to do to the covered population. Those CBO scores, Congressional Budget Office scores, should be out on Monday or Tuesday of next week, and then we can tweak the bill to try to deal with those issues.
So how do you deal with the conservative members, the Freedom Caucus, who and they say folks like Congressman Jim Jordan who say,
right,
I'm sorry, we are not supporting this?
Well, Jim Jordan is going to have to go back to his friends in Ohio and hold up his voting card and say, I voted to keep Obamacare in place because I voted against the first step of a three-step plan to try to fix it.
There's a lot of folks who are showing up at those town halls who are Republicans who support the Affordable Care Act.
Not many.
First of all, I mean, I've seen a whole lot, and then when Republicans have tried to say, these are folks who are being brought in, they're people who hold up their driver's license, and so, and you've seen that. How do you tell those folks who say, wait a minute, this plan won't be the same as the Affordable Care Act?
Well, if you look at the Affordable Care Act today, it's broken. I mean, you look at our home state, Roland. 70% of the population, 70% of the counties have one health care provider, and a lot of those at one health care insurance company, and that's going to go away beginning January 1st of 2018 in several of those counties. If you show up at the hospital and you pull out your insurance card and the hospital says, oh, good, you've got insurance, but you've got a $10,000 deductible, that's like having no coverage at all if you're a middle-class family. So that puppy doesn't play very well back home, and so we've got to go back to our constituents and say we've got a better way, and that's what we passed yesterday.
Last thing, why in this bill is there a provision that hooks up companies when it comes to the CEOs of the salaries of CEOs? Why is it even in there?
There is no provision of that nature in there. I'm not sure. I keep hearing that. I heard it.
No, actually, the provision, in terms of, it actually lifts the cap in terms of companies being able to deduct the salary of their CEOs.
Oh,
I mean, why is it even in there?
Well, I don't know why it was in there to start with. I mean, do you want to have do you want us to pass a law that restricts your salary?
No. It's not necessarily restricting, but again, it's hooking the companies
Do you
up.
want us to pass a law that says that your company can't deduct the cost of your salary?
But why is it in this bill, though?
I don't know. I mean, I'm not sure why it was in the original bill. What we did is we put tax policy the same for everybody. So if you are an employee of a company, the company gets to deduct your salary. That's what we basically said.
Okay. So, all right, we'll see what happens. And again, Freedom Caucus, none too happy. So
well, they'll come around.
They'll come around?
Yeah.
Okay. All right. Those might be famous last words, Congressman Flores. We appreciate it. Thanks a bunch. A peaceful protest turned deadly. 37-year-old black man was shot and killed by Baton Rouge police. His hands are in the air, and you still get shot by the cops.
Oh my God, please don't tell me he's dead.
We're not gonna let hate define us.
Race is a big part of this.
If truly all lives matter, then all lives need to matter equally.
What we require is action. What we require is accountability. We understand that black lives do matter, and we will keep focused on this issue.
NewsOne Now, every weekday morning at 7 on TV1.